The demographics of Europe are changing, and its healthcare systems need to change too, and fast. That's the message from this month's conference in Brussels, Acting Together, a roadmap for sustainable healthcare. In 2050, 37% of the European population will be over 60, presenting huge challenges. The European Steering Group brings together politicians, healthcare practitioners and academics to discuss what should be done. Former Irish Health Minister Mary Harney chairs the group.
The status quo in health is no longer an option. If we want to continue with a health service in Europe that's of high quality, universally acceptable to everybody on the same basis, without care being rationed, then we have to transform in a radical way the way we provide services, how we intervene with patients at an earlier stage, and how we empower citizens to take more control and manage their own health.
The steering group has already developed around 30 pilot projects. After more than a year gathering data, the group presented a white paper of recommendations at the Brussels conference.
Today we have an old population, particularly in Europe and especially in Italy and Germany. For people with chronic diseases that last many years and cannot be cured, we must reorganize services, not only hospital services, but also assistance outside and at home.
Chronic disease affects more than 80% of people over 65. It costs an estimated €700 billion in healthcare spending every year.
If I take the example of oncology, obviously oncology has moved from very acute condition with very serious prognosis to now, for several of them, chronic condition. But we can achieve this stage by early intervention. So really early intervention, early treatment can minimize the seriousness of chronic condition and help people living longer.
Early intervention is at the core of a Madrid-based research project on musculoskeletal diseases, the main cause of disabilities across all ages. The initiative has seen impressive results.
We were able to cut by 40% the numbers of days of work of people with recent onset work disability. The economical results were very good because for each euro that you invest in the program, you get a return of 11 euros in a couple of years.
Promoting responsible, healthy lifestyles can have a big economic impact. Researchers in Rome have built a model for predicting exact figures.
Healthier lifestyles can enable people to be less overweight when they reach the age of 50, allowing Europe to save up to €100 billion between now and 2050. And this is only through lifestyle changes, not taking into account medicine or other measures.
Reorganising healthcare systems may be a necessity, but the EU Commissioner for Health warns of the danger of cost-cutting in the wrong areas.
If we speak about structural reforms, we must speak about impact assessment on public health. You can't destroy access to health care in your so-called structural reform. What does it mean, health care? It's precondition for growth and jobs.
The experts are all agreed that prevention is better than cure, better for people and better for the economy as well. But finding the best ways to put that into practice remains the biggest challenge.